Today, today I'm talking about the ABC strategy of the stress management and the psychological vaccination during the COVID-19 for the management of the stress. Before that, I want to talk about the stress. The body and the mind response to demand. Stress is the process of the adjusting or the dealing with the circumstances that disturb or the threaten to the disturb a person physical and psychological functioning. Stress is the tension, strain, or the pressure from the situation that require us to use, adapt, or the develop new coping skills. Stress is a natural physical and mental reaction to life experiences. Everyone experiences express stress from time to time. In time from the everyday responsibility work and family to serious life events such as the new diagnosis of the COVID-19 can trigger stress. For the immediate short-term situation, stress can be the beneficial to health. It can help cope with the potentially serious situation. Body response to stress by the releasing hormones that increase the heart rate and breathing pattern increase and ready to muscle to respond. Stress means the different thing to the different people, like not same thing in the same people. It is a individual differences, so it will differ from the people also. What stress is one person may be of little concern to another. Some people are the better able to handle stress than others, and not all stress is bad. In small doses, stress can help accomplish task to prevent from the getting the hot, like the getting hot. Like some of causes of stress which like causing factor to develop the stress in the during COVID-19 in COVID-19 and the causes of stress is the some causing factor is there. First is the workplace stress. Yes, definitely like frontline health worker are getting the stress because they are not getting the personal equipment like the masks, gown, or the personal protective measures, so that people are the very afraid to the like work in the like the hospitals area. That is the very workplace stress, and they having the like duty burden of the duty or the organization pressure is there. Second is the financial stress. Financial stress means here the people not getting the like the due to the lockdown period, people are not getting the like the job, or the not getting the like the work from the office, or the not getting the like earning, they are not earning the money in the some people, some office they are not getting the like the salary properly, they having the financial proper like problem is that it is the very like the most triggering factor. And next one is the personal problem also is the cause of the stress in the frontline health worker. They having the family, they are not giving time for the family, they are not managing personal space, or they are not taking caring of the personal things, they are not giving time for the family because of the hectic duty schedule. And next one is the irritant or lack of the support system. Definitely this is the irritant is nowadays during the COVID-19 people are not getting the like the support from the home, community, society, and family also. That is the stress factor. And then next one is the biological causes. Biological causes, people in the frontline health worker not getting time to eat in like healthy diet, or the not getting the sleep also. Because of that also, like hormonal level will the like fluctuate that. Because of that also, like the individual will get the stress. Next one is the social distancing. Due to the like the COVID-19 people are maintaining the social distancing. So it will prevent the like the contamination of the disease or the spreading of the disease. But still people are the social beings, so they want to interact each other individual, like the they want to talk to other people also. Due to the social distancing, this is the very difficult to the maintain that one. Next one is the loss of routine. People having the due to the COVID-19 or the like the due to the lockdown, people are not maintaining their routine activity because they are the like the stress, they are the getting frustration, so that they are disturbed in their activities also. In the fear of the contamination and the contaminating to others, definitely people are having the fear where if they are going the like outside the home, or they are going the like market, or they are going the shopping, or they are going the office, or they are traveling in the bus, they will they having the fear if they are going the outside, they will like develop the contamination. In the frontline health worker, like also same, if they are touching like without PPE, they will get the contamination, and they will transmit the contamination to the other person also. Next one is the stigma and the discrimination. It is the very like the most common factor for the stress in the like during the COVID-19. almost like the worldwide people or the frontline health worker are the getting like suffering from the stigma and the discrimination, because society, people, community are not accepting them. They are thinking they are the main source of the like transmitting the coronavirus. Because of that, they are not getting the like staying the home, or the like that they are not entering the society. People are the abusing them. That is the main factor. These are the main causes of the developing the stage during the COVID-19. And what are the symptom like people are developing symptom? Mainly I want to talk to about the four area. One is the physical symptom, mental symptom, behavioral symptom, and the emotional symptom. In the physical symptom, people will develop the like body pain, ache, or the diarrhea, constipation, and sometimes nausea also, and dizziness, chest pain they will develop. They having the like the rapid heartbeat. They will develop the palpitation and headache also they will develop, and fatigue and fainting. They having the disturbance in the sleeping pattern changes, and some people are developing sweating and trembling. They're having the like the low of the energy, and the people are feeling the dry mouth and the difficulty of swallowing. These are the physical symptom. And the behavioral symptom also people will develop, like the appetite change, either less or the more eating habits, like the eating disorder will develop, like the anorexia nervosa or the bulimia. And the increase of the like substance abuse, alcohol drink, like consumption, and other like substance stimulants they will use. And some people are increasing the like the smoking. The people can't do the like the rest, that people are suffering from the restlessness. Some people are doing the nail biting, and hypochondrosis also develop, people will develop, and avoiding their responsibility. These are the behavior symptom. And emotional symptom, people will feel the cheerfulness, and like the deterioration of the personal hygiene and the appearance, and people will feel the anxiety and the agitation. And same in emotional symptom, people will get the frustration, moodiness, irritable, anger, and the loneliness. People will feel the isolation, and the people will like the or the feel the like social withdrawal, or the difficulty to relax and avoiding the other people. And people will finally get the depression and the like general unhappiness. These are the emotional symptom. Then the finally is the mental symptom. People will not like concentrate their work. A lack of the concentration will be present, and the people are like not making the properly decision making. It is difficult to making the decision, and the people almost all time people will show the confusion symptom. People can't able to focus their task, that is inability to focus task, or the people will show the disorientation symptom. And the people will see the everywhere, or the every people with the negatively seeing only the negative things they will see, and they having the poor judgment skill. Some people will develop the panic attack also, and the people will like the constant worrying, and the memory problem, like the memory like the lapses. And some people having the like the racing thought problem will come, thought will the racing. These are the mental symptom is here. So now I am talking about the ABC strategy for the stress management. A for the awareness, B for the balance, and C for the control. Here I am talking A plus B is equal to C. That means awareness plus balance plus control. Here awareness means we have to think about the knowing what is that cause of the stress, like which factor making the like the stress to the people. Here we have to aware about that. Like in for that, how to manage in that. And always take time for the yourself, at least 30 minutes per day, and be aware of your own stress matter, and make cool down of yourself. And the concentration on your like concentrate on controlling situation, not like the people or the everybody, like without controlling to everybody. And do the daily exercise. It will help to burn out your stress chemicals, and make the healthy eating habits. And always keep a positive attitude, and avoid the like the alcohol consumption, drug consumption, and other stimulant consumption. And sleep at least 6 to 8 hours per day or the night. And treat yourself well, you are the like the special person, and just for life. And like the each day is a gift. Smile and the thankful that you are the part of the like the bigger picture. This is comes under the awareness. Then second one, I am talking about the balance. Is learning positive way of the balancing the stress in your life. There are the fine line between the positive and the negative stress. I'm talking about here, and what is the negative stress? It is the like the contributory factor in the minor conditions such as the headache, digestive problems, skin complaint, insomnia, and ulcer. Excessive, prolonged, or the unrelieved stress can have the harmful effect on the mental health, or the physical health, or the social health, and the spiritual health. It leads to anxiety, feel the unpleasant, or the decrease the performance, and the lead to the physical and the mental disturbances. So that is the like the negative stress part. And I'm talking here the positive stress. The positive stress can also have the positive effect, like the encourage or the stimulate to the people in the motivation and awareness. providing the stimulation to cope with the challenges of situation. Stress also provides the sense of the urgency and alertness needed for survival when like the confronting the situation, like the motivates focus focus on energy and perceived as within or like within our coping abilities, and then the feel like the exciting and the improve performance. Like here the like we have to maintain the balance. In the last one I'm talking about the control, control I already told. In the awareness plus balance is equal to control. In the both we already talk about the awareness and the balance. So if you are the aware of the situation that you find it stressful, and you have the tool for the positive like handling this stress, then you are you are on the way to getting control of your stress and your life. So before in that awareness, what are the positive factor, we have to aware about that, and we have to maintain that one. In the balance means positive and negative stress we have to find out, and based on that we have to control our situation. And here in the controlling here we have to think about what are the some situations that make you feel stress. Yes, definitely. And what are some of the activity you involve like yourself in like help you to take the relax, and how many of these activity include some kind of the physical activity. Like think of one new activity that you can do that will help you to relax when you feel the stress. Then stress management technique also is there, like change your thinking pattern, change your behavior pattern, change your lifestyle. It comes already in the control and the self awareness also. Here the changing your thinking pattern, you have to focus on your strength, and you have to learn from the stress you are under, look for the opportunities and seek out the positive positive make change. And reframing is a technique of the change, that you look at the things in order to feel better about them. And there are the many way to interpret the same situation to pick the one you like. The reframing does not change your external reality, yes, but help you view things in a different light, and the less stress, like less stress in change your behavior. In here the get organize yourself and ventilate your feelings, express your feelings, express your opinion and beliefs, get away from the things that bother you, and reduce your stress level, calm down, think logically, and maintain time management is the most important here. In that you have to make the list, like the what must done, what should be done, and the what would you like to be do, and cut out time wasting time, the time taking out. And change your lifestyle in the you have to change your lifestyle, you have to develop the healthy eating pattern, healthy eating habits, and avoid the smoking, alcohol consumption, drug consumption. Do the regularly exercise, and use usage of excess energy released by the fight and flight reaction, and clear the time of the worrying thoughts, and improve your self image, and make you feel better about yourself, and maintain your sleep patterns, promote the sleep, and engage in your leisure activity, like the doing home task, reading news, reading journal, watching movie, and the singing, dancing, and all those things, and do relaxation, and do the yoga and meditation. In finally, I'm talking about the here seven the psychological vaccine that protect mental health from the COVID-19. So seven it is not the injection, it is the the psychologically how to maintain your mental health. That is first one, the encouragement. Second one is the positivity. Third one is the practice. The next one is the fourth one is the knowledge. Fifth one is the hope. Sixth one is the information, and seventh one is the balance. Yes, first I'm talking the encouragement. Accept and acknowledge the stress response as normal, and encourage yourself. I'm controlling my emotion, and taking good care of my worries. I need to be careful, but I won't worry too much. Yes, definitely. And the second one, a positive. Positive means to do good thing to the others. It's my do small thing that help relieve stress for the people around you or the member of the community. It's okay, even if it's the travel or the not all the serious condition. I will send a message of the encouragement, or the to call someone who having the hard time. And the third one, the practice. practice here that take the like the initiative in the keeping personal hygiene regulation. Here the observe personal hygiene regulation and act morally and ethically. I will wash my hand well, always wear a mask, and keep my cough like former manner, or the like when I am coughing I will do the in the like the protect to other people also, not like the spreading in the environment. And the fourth one is knowledge. We have to take the knowledge from accurately, get regular access to the information from the trusted sources, and get to the know the like coronavirus properly. I'm gonna I'm not gonna be fooled by the fake news. Yes, definitely in the whole day we are engaging in the Facebook or the reading the unnecessary like the news, so it will develop the more stress. So that we have to the get knowledge from the trustworthy sources like the government, like the Ministry of the Health, and trusted sources at least in the per day, twice a day, at least 20 seconds, or the 5 to 10 minutes we have to see the trusted sources from the news. Trusted sources from. And next one is the hope means here the hope, like the no it's over at the end, like the many infection disease from many infectious disease or the disaster have the cycle clearly organized that in the come after the coronavirus disease pandemic. Even it is even if it gets a little longer, it will be the over soon, the like the cure will be the out soon. Say, sixth one is the information. Know how to get to health, and from where to get help. Check in advance where to conduct when suspected symptoms occurs, such as the public health content, like the center or the screening clinic, like the where we have to do PCR, where we have to get like the admission, yeah, where we have to get the information. Like there are the many places to the help, and all I have to do is get in the touch. In the last one is the balancing. The balance means here the maintaining a balance, like the balance region here. Strive for the balance of the emotion and the region, the balance of the body and mind, the balance of the family and work, and the balance of the anxiety and the stability. Loss of balance between body and mind create the confusion. Definitely it will confuse, and it will be make people the confusion. Try to have a like the proper sense of balance. Let's trust my region, let's deal wisely, and wisely don't don't get too emotional. So I talk about the like ABC strategies and like the seven psychological vaccination for promote the mental health. So finally I'm saying here one quotation: avoiding the right attitude avoiding the right attitude can convert a negative stress into the positive one. So stay safe, stay healthy. Thank you.